Respect for those grieving George Floyd and those who are protesting his death, and called for a statewide moment of silence yesterday at 2 o'clock at the start of his memorial service in Minneapolis. But DeWine still had some big announcements to make. For instance, zoos and aquariums, movie theaters, playgrounds, indoor sports, laser tag, trampoline parks, all among the venues that are going to be allowed to start opening on June 10th. Not included amusement and water parks, which led Kings Island, Cedar Point, and Kalahari Resort to file a lawsuit to open immediately. Before we go to the governor's press conference, let me check in with my colleague Andy Chow, who is here today. You have some new numbers from the Ohio Department of Health.
That's right. Coronavirus.ohio.gov is now reporting 35,096 confirmed cases of COVID-19. Now that's based on COVID-19 testing. There are 2,662 probable cases using the CDC definition. That brings the total to 37,758 total cases. There have been 6,385 hospitalizations since the beginning of the pandemic. The Ohio Hospital Association reported yesterday that there were about 690 people in the hospital yesterday with COVID-19. The confirmed deaths number is now at 2,135. Probable deaths related probably to COVID-19 is at 220, bringing that total to 2,355.
And so 2,135, the confirmed deaths, that's 18 more deaths than yesterday, 457 more confirmed cases over yesterday. Let's talk a little bit about yesterday. Again, the governor did cancel his press conference out of respect for George Floyd's family and called for a moment of silence at 2 o'clock when we would normally be here. The Ohio House met yesterday as protesters were outside. The Ohio House held a minute of silence. Protesters laid down in front of the State House for 8 minutes and 46 seconds.
Yeah.
But then the governor did release some information that he had promised us on Tuesday that he would have about some new reopenings.
Yeah, so what they're categorizing this, they're calling it the entertainment venues. So museums, playgrounds, zoos, art galleries, ice skating rinks, a long list, 15 places listed off there. And so I think what's interesting here, and I think this is one of the benefits of having a press conference today, is kind of getting into more information on that.
All right, let's turn it over now to Governor Mike DeWine, who's taking over the podium. Let's hear from him.
Good afternoon, everyone. Thanks. Fran and I just came back from planting a tree at the Ohio State Fairgrounds in the Ohio Department of Natural Resources area, something we were honored and privileged to do last year. Our daughter Jill was with us, and our granddaughters Izzy and Mary. Today I'm wearing my dad's tie. You may not be able to see what's on there. But my dad and my mother and my grandparents were in the seed business at DeWine Seed Company, Yellow Springs, and someone else in the seed industry, a friend of my dad's, gave this tie to him. It's an individual who is sowing some sort of seed. Tomorrow is the virtual memorial service for Annie Glenn, who died last month from complications from COVID-19. The service will be online at 11 a.m., and it will be on WOSU website, also WOSU TV, or on the John Glenn College of Public Affairs website. Mrs. Glenn was a fine musician, and I was sent this performance by the John Glenn High School Virtual Symphonic Choir, under the direction of Minda Kaiser from the Glenn's hometown of New Concord. The choir recorded it for the 2020 virtual graduation. The song is called I Will Sing You the Stars, pretty appropriate. Not only does this fit with John Glenn's career as an astronaut, the lyrics also assure all of us that we are truly not alone. Let's listen. Very nice. Fran and I would also like to extend our heartfelt condolences to those who love Bishop George Murray, who died this morning after his fight against cancer. Bishop Murray led the Youngstown Catholic Diocese since 2007. Was the first African-American, first minority bishop to hold that post. Our prayers are certainly with all those in the diocese who loved him. I want to take a moment as we start today to address a situation regarding a member of the Ohio National Guard who was removed from the mission in Washington, D.C. after the FBI uncovered information that this guardsman expressed white supremacist ideology on the internet prior to this assignment. We were asked specifically by the Secretary of Defense, as I know other states were, to send guardsmen to Washington, D.C. We sent 100 to Washington, D.C. While I support everyone's right to free speech, guardsmen, women are sworn to protect all of us, regardless of race, ethnic background, or religion. Our Ohio National Guard members are in a position of trust and authority during times of crisis, and anyone who displays a malice towards specific groups of Americans has no place in the Ohio National Guard. The Ohio National Guard and our Ohio Department of Public Safety are fully cooperating with the FBI in its investigation. This individual is suspended from all missions effective immediately. Due process will take place, whatever that is. This is an investigation being done not by authorities in Ohio, but by the Federal Bureau of Investigation. Following due process, it is highly likely, when these facts are confirmed, that he will be permanently removed from the Ohio National Guard. I have, because of this incident, directed General Harris to work with our Public Safety Director, Tom Stickrath, to set up a procedure so that occurrences like this cannot and do not occur in the future. The public must have faith in our Ohio National Guard. They do amazing, amazing work. And it's been my pleasure for the last, since January of last year, to with a number and meet a number of members of the Guard. They're citizen soldiers. They do absolutely an amazing job. But we must constantly be vigilant, and we will be. And we will set up a procedure to make sure that this does not happen again. Earlier this week, we talked about many of the tragic disparities that still exist in Ohio today. Over the next several days, we'll be talking in more detail about our ongoing efforts to address these inequities. Some of the things that we're going to be doing and are doing, the prioritization of COVID-19 testing in minority communities with the help of our Ohio National Guard. We're going to talk in more detail, and Dr. Acton will, about the position that the Health Department, Dr. Acton, has created in the Ohio Department of Health to focus on the social determinants of health, position that Dr. Acton has talked to me for some time about and how important that is. We're going to focus on our efforts to focus on minority health through the State Health Improvement Plan, and we will focus, as I indicated several days ago, on police reform in Ohio. I've been talking to members of the General Assembly about this. Those conversations will continue. I'm committed to making tangible changes in police oversight, accreditation, training, and accountability. Our goal is to improve the professionalism of the profession, because it truly is a profession, and make it a community that does not show at any time any problems connected with police conduct. Let me again just say, the members of the police departments, who I have known, some of them since I was an assistant county prosecutor over 40 years ago, are wonderful individuals. But we also know that occasionally someone slips in, and we have to be ever vigilant in regard to that, and we will be. And I will have specific reforms that I will be discussing with the General Assembly in regard to this. In an effort to ramp up COVID-19 testing in Ohio, we've expanded our testing priorities to ensure more people can receive tests. As you remember, before we were testing with focus on healthcare workers, first responder, those most at risk who had symptoms. With expanded testing, which is moving forward, healthcare providers are able to test anyone with symptoms, This week, we've been active in reaching out to retailers across the state of Ohio, particularly in the pharmacists, to strengthen our testing partnerships. And I have talked on the phone with a number of CEOs this week. This week, our team and I spoke with executives from CVS, Rite Aid, Walmart, Walgreens, and Kroger about the importance of testing and how, by identifying positive COVID-19 cases, we can limit the spread of this virus. With expanded testing criteria, our partnerships with these retailers and our partnerships with community health centers are more important than ever. The partnership with the community health centers is also something, as I said, we're very excited about. You can go to our website, coronavirus.ohio.gov, and you can click on Testing and Community Health Centers at the top of the page. There you can see the locations of places where you can get a test. Once you find a location that works for you, click on the link of the retailer or community testing site to schedule at that test. Currently, there are more than 40 retail testing locations across Ohio, and we expect more of those in the future. And again, I've encouraged these retailers, particularly these pharmacies, to create more testing sites, and they have told me that they will. The testing site map also includes a list of community health centers, also known as federally qualified health centers, FQHCs. These centers, located all over the state, are places where people who may not have a primary care provider can call to get more information about where they can get tested. And they can get tested in a number of these centers and sites. Again, by learning who has COVID-19, we can isolate those individuals who are sick, we can help them recover, and limit the spread of this virus working together. It's been my pleasure this week, in the last 7 days, to be on the phone with our state university presidents, both private and public. And let me just say that we are very proud in Ohio to have some amazing universities, both small liberal arts schools and our big state universities, who provide our children, our young people, and sometimes not so young people, with great education. The research that many of them do is vitally important to the future of the state of Ohio. So we're very pleased to be on the phone. I want to hear directly from them in regard to what their plans were for opening in the fall. They plan on opening in the fall. They all have contingent plans in case things at some point in the future are not good and they have to pull back. They all have contingency plans, but they all are planning, best of my knowledge, to start up in the fall again. And I'm very proud of the work that they are doing. We in the governor's office will continue to work with them and serve as a resource for them in regard to testing and other efforts to help protect the health of students, faculty, and all college and university employees. I'm going to give a brief update about PPE, but actually I'm going to wait because I'm running out of time, and we will do that. We will do that next week. General Harris is on the line. Eric, if you can get the general. The general's up there. General, good to see you again. Where are you reporting from? Where are you right now, General?
Sir, I'm at my headquarters.
Well, we appreciate it very much. We've talked a little bit to our fellow Ohioans about the work that your men and women are doing in regard to testing at nursing homes. And I'm just wondering if you could give us a kind of a brief description of how that is going so far.
Oh, yes, sir. This is in keeping with the intent that you gave us early on to develop a strategy to use testing, not only to save lives, but to protect our most vulnerable population. And we know that much of our vulnerable population are in nursing homes. So I think it's also important to point out when we talk about testing, we have to understand it's a multidisciplinary approach. It's not just the National Guard that's doing this. It's really a three-phase thing that we do. The first phase is when the experts come together and decide how we will do the testing. In other words, the strategy for which nursing homes we should go to. There are over 960 nursing homes in Ohio. Not only which ones we should go to, but also when we get there, who should we collect samples from? We know that we're going to do all the staff. That's a given. But also, what's the strategy for sampling inside the nursing homes so we get the best clinical results that are going to give us the most information about COVID in that facility? It may not necessarily be 100% testing. 100% testing just once really provides very little effect for us. So the clinicians, that's the departments of health, that's our health department here at the state, that is the academic community, they will come together and give us that recommendation. They hand that to the National Guard. And then the National Guard teams will actually go into the facilities and collect the specimens, what we call swabbing. And again, we do that. We do 100% of the staff, and then we do that segment of the residents that the clinical community recommends for us. I want to point out, sir, that these teams are all medical personnel. This is not a pickup team. The minimum level of experience that we have on that team is someone who's at least an EMT certified in the National Registry. In fact, our officer in charge of all these teams, Major Jessica Taylor, I'd like for you to see her. She's the person getting this work done and all the coordination for the National Guard. Major Taylor herself is a nurse. She's actually the occupational health nurse for the Adjutant General's Department. But before that, she did 6 years. She worked for 6 years at the University of Toledo, at the Toledo Medical Center. She has an undergraduate degree from the Ohio State University, and her postgraduate degree is from the University of Toledo. This team is comprised of incredible National Guard professionals. I was going to talk about her kids, but she asked me to talk about her 2 dogs who are her fur babies. But this is the kind of person who steps forward to do the work of the National Guard every single day, and I couldn't be more proud of the work they're doing. So when her teams go into the facilities, they will generally be escorted by the staff so that the residents in these facilities are comfortable with our team, and we very respectfully collect the specimens. A lot of administration to ensure that when the lab gets the results, that the results are properly documented, and that any feedback can go to the appropriate personnel in that facility. This is protected health information, and we treat it very respectfully as such. So we collect the specimens. We have 12 teams that are comprised to do this, and when the specimens are collected, we seal them up so that they stay in a good condition, and we transport those to the laboratories. There are 11 labs going to 12 around the state that process these for us. So we collect the specimens, and this entire process is called testing. And on the backside of testing, I think, sir, it's important to say that that part is as important as any other part of the process, because once that facility receives the results, if we don't have an aftercare team that helps them figure out what to do with them, our help is of little value to them. So the aftercare team will go to that facility, again, a cross-disciplinary team that helps them determine what to do. In other words, if they lose staffing because they know that those people are positive, then we may put together a program to help them surge that staffing. If there's a certain wing or a part of the nursing facility that they have a prevalent problem in, our experts, the experts from the state, will help them figure out how to isolate that facility, quarantine the right personnel, provide that clinical approach to control the spread and save lives in that facility. So we're ramping up very quickly to all 12 of those teams, and we will press as hard as we can, sir, to reach the maximum testing capacity here in this state, not only for the nursing facilities, but as a part of the overall comprehensive testing process for the state of Ohio. So, sir, we're moving rapidly to execute your intent to save lives and protect our vulnerable population here in Ohio.
Well, General, thank you very much, and Major, thank you. We appreciate your great work, and the great work, General, of all the men and women of the Guard on this very, very important mission. Thank you very much.
Thanks, sir.
Thank you. Yesterday, we announced some specific categories of businesses that can, in fact, now reopen. We put that out in a release. Today, we'll be announcing some additional ones as well. But before we talk about those, I want to kind of set the scene a little bit here. There are still a few categories of businesses that have not been reopened. Let me just tell you that we are working on those, and those will be open shortly. But I do want to go back a little bit and talk about how we have done this and why we have done it the way we've done it. We have done this in phases. I know some people have said, well, why didn't you just, May 1, open things up? And the answer is that we wanted to layer this. We wanted to do it in phases. We wanted to reserve those things that had more people, frankly, potentially higher risk until the latter part of that. But the layering and putting this out over a period of time, we did because, frankly, we didn't know what the results were going to be. And we still are not totally sure. But because our indicators are always lagging, someone is infected, it takes a while, obviously, before that person knows it. That person maybe ends up in a hospital, or somehow we start picking them up on our data. So because of that lag, and because, frankly, the virus is still very much out there, it's not gone away, we wanted to do this in phases. We wanted to layer it out. And so that is what we have been doing. We in essence, kind of the summation is we simply wanted to be able to monitor the results and see how those results were going. We look at data each day. We look at hospital admissions. We look at new cases. We look at all kinds of different things. We talked about the R-naught, which is basically when one person infects how many other people. And at one point, I think we're like 2.5 or 3. One person would infect 3. The numbers are now down statewide below 1 to 1. So we've watched these numbers. And while we may have some variations in different parts of the state, the movement statewide is good. We are below, at this point, one person infecting another person. So all of those things allow us just to continue to move forward. Cautiously, carefully, virus is still there, just as lethal, but because we've done this in stages, we've been able to monitor. Let me talk about what our goal has been. Our goal has been, and you remember we started by putting a working group together that looked at retail, looked at manufacturing. They came back with recommendations. These were people who were in that business, in those industries. We came back. We did the same thing with people who cut hair. We put health people together with people who are experts in that particular field. And what our goal has been to come up with the best practices. So our goal is to make each business, each activity, each venue that we have opened up as safe as it can be made. And we've done everything to do that. So again, the goal is to make each business, each activity, each venue, as we open them up, as safe as they can be, consistent with the uniqueness of each event and consistent with actually doing the event. In some cases, as we've talked about, some businesses, in most of these cases, we've had specific working groups made up of people in the industry, the profession, and health people, and they have come back with these best practices. In other cases, we've also had, though, the businesses themselves that have taken it upon themselves to put a comprehensive package together that they shared with us and filed with us, submitted to us, and that they either have or will submit to their local health department. These are specific, they're elaborate plans, I would call them elaborate, and elaborate specifications. Many of these have been, frankly, extremely impressive. Impressive in their detail and the care in which that they have been done. As we have moved through this, we have gone from one to the other. And a week ago, I think it was approximately a week ago, John, we had a conference call with some of these that I'm going to talk about. And they had submitted to us detailed plans. And we had a conference call for them to talk about it. And our commitment to them was that in a week, we would, in fact, get back with them. And so it has been a week. We have now had the chance to review all of these. And so we are ready to move forward. And I will announce those in just a moment. But I want to talk for a minute about those who say we should open Ohio with no requirements, no specifications, no best practices for business or whatever the activity is. And I know there are some friends out there who are watching this right now and say, right on. Mike, that's what you should be doing. Why aren't you doing that? And I want to address that. And I want to address my obligation as governor of the state of Ohio. Some say we should open with no guidance and no rules. And what's my answer to that? My answer to that is to do that in the midst of this pandemic makes absolutely no sense. And in fact, with the virus still out there, with the virus as contagious as it has ever been, still very, very much alive, it would be, on my behalf as your governor, irresponsible to do that. It would not be the right thing to do. It would, frankly, to do that would be an abandonment of the duty I have as your governor. And I do not intend to do that. As Eleanor Roosevelt once said on the eve of World War II at the Democrat National Convention, these are no ordinary times. And for us, in the middle of this pandemic, these are no ordinary times. In fact, this is a time in our history when caution and good judgment are required of all Ohioans. Again, some argue for no standards. Why can't I just go about my business? Why do we have to have any kind of standards at all? My answer to those who say that, with all due respect, is you have the right to make decisions that solely impact you. But once your actions start impacting other Ohioans to their detriment, to their serious detriment, we have to draw back a little bit. We're all familiar with this basic principle. One of the things I did when I started my career as a county prosecuting attorney, actually an assistant county prosecutor, is I prosecuted drunk driving cases. So let's take the alcoholic who decides every night he's drinking, and he or she drinks in their home. Most of us have pity for that person. Most of us would like to talk that person out of not doing that. But that's at one level. It's what they do, however tragic it is for them. But when that same individual goes out and gets in their automobile and drives their car, that's fundamentally different. And so what we have come up with is a way, while respecting the rights of all Ohioans, we've come up with a way to add the protection that we can based on best practices so that when you go into a business in Ohio, you know they're following those best practices. And when an employee goes into a manufacturing company, so they know they're following those best practices. Ohioans have done an amazing job. They're doing it. They're doing it every single day across the state. And it's very, very important. Yesterday, we announced movie theaters, art galleries, ice skating, roller skating, and a number of different things. That was out in the press release. Today, we are announcing categories where, by and large, we have a specific plan over and above the plan or the requirements, the general requirements that we have put forward. So we're announcing today that 2 weeks from today, the casinos, racinos, amusement parks, water parks will be able to open. Our outdoor theaters, we have several great outdoor theaters in Ohio. Once they submit to us a plan, I'm sure they will be able to open as well. We also have received plans and conversations in regard to the Memorial Tournament, and we received a document called the Memorial Tournament Activation Plan, calling for the Memorial Golf Tournament to be held on July 13th to 19th, and we are approving that as well. In each one of these cases, and I won't go into details today, but in each one of these cases, they have come up with plans that in many cases dramatically reduce the number of people, provide for sanitation, in some cases provide for one-way traffic. They are quite elaborate plans that we believe are consistent with protecting the public and consistent with allowing Ohioans to go about their summer and enjoy their summer in the way that they are used to doing that. Let me turn to the Lieutenant Governor.
Thank you very much, Governor, and good afternoon. It's great to be with you today to talk about some of these reopenings. I want to build on what the Governor just said about that process. We've been persistent at this. Every day there's a team of people 7 days a week who are working on these evaluations and reopenings for businesses and sites and attractions that we know make Ohio a great place to live and work. And so we want to get them going as fast and as safely as we can. It's worth repeating that all of today's reopenings, whether it's the golf events, the racinos, casinos, water parks, amusement parks, all have plans that they will file consistent with making those venues safe. And these are businesses who and events that care about making the experience safe for the people who come there and want to be a positive contributor to both leisure and fun activities, but also the good health of the people of the state. We recognize that even with all of the openings of yesterday and today, that there are a handful of things that we have not opened or provided guidance on. That work continues, whether it's professional or youth sports, particularly those that involve contact. We regularly, once a week, talk with the Ohio High School Athletic Association on building plans forward for that, or those large venues, stadiums and auditoriums where you have a large number of people, figuring out how you can appropriately scale and create that safe environment there. We learn new things every day. That's important to know. We know so much more today than we did when this started. CDC gives new guidelines. The science evolves. And then when that happens, then we revisit these plans, both in terms of what opens and how it opens, because we strive to make things easier for businesses to help them comply with this in as safe a manner as possible. And as we learn, with that knowledge, we improve the way that we're attacking these reopenings. And reopenings require responsibility and respect for each other, and we want you to know that we respect and acknowledge the tremendous challenges that the COVID pandemic has placed on businesses in this nation and in our state. We know that all the uncertainty, the financial stress, and your desire to protect your employees and your customers is a tremendous challenge. And we value your work and we value your advice on how we can help you get this right. We aim to be responsive and responsible in that respect, and we know that as the businesses are out there struggling, I guess I want to close by making a pitch to you. Your fellow Ohioans who run these businesses and work there, their lives and livelihoods depend on it, so buy Ohio. Go to your friends and neighbors' businesses and help support things right here in Ohio as we reopen, rebuild, and re-energize our economy. We are all in this together. That work continues, and we continue to do it aggressively and safely. Thank you.
Lieutenant Governor, thank you very much. Dr. Acton.
Thank you, Governor. Thank you, Lieutenant Governor. I'd like to get to our numbers. First of all, we now know that in Ohio, we have 37,758 cases as of today, and deaths in Ohio at this point are at 2,355. Our next slide continues to look a lot the same in terms of where we're seeing the cases. As you can see with General Harris, we're trying to save lives by targeting our most vulnerable populations. And right now we're really focusing in on our nursing homes in Ohio, coming alongside of them, as well as some targeted testing in our minority communities, disproportionately affected. Our trends are staying even, as the governor said. Our R-naught also is looking good at this point. We're staying steady, and in many ways, that is in large part due to you. Testing increasing both in the private and public sector, and we're getting more and more targeted each day with this. Again, our R-naught number that was mentioned. I just want to say one last thing and mention to you, as the governor said, we have really done everything we can to bring you the very best guidelines and expertise in terms of our opening up. But I want to say a little bit about your health and well-being. These are definitely no ordinary times. This is a shared experience that we're going through. And early on, I said, we are not shutting down, we're waking up. As we're opening, we're also waking up, and we have to be absolutely more intentional than we've ever been. This is kind of a good thing. It's not a bad thing, but we're thinking about all those basics as you go forward and about your business. It's so important to remember the social distance, the masking when you're in environments, when you're close up with people wearing that mask. It is the cleaning that we have done. It is all of the disinfecting, everything. But importantly, I'd like to add a couple new things to you. One is always think before you go. Look ahead. Some of my favorite things in being outdoor are going to parks, going to the conservatory, going to Dawes. Make sure to always look ahead, because you have to plan as you go about doing things. And there's lots of guidance on websites to help you do that safely. Also want to say to you to go with grace, because a lot of us feel a lot of stress of these things. More important than ever, everyone is doing their very best. So I ask of you in all your interactions, when you're frustrated trying to get answers, to always do so with a little grace for each other. This moment is calling us to new things, and we are in this together, and so proud of all you're doing, Governor.
Thank you, Doctor. We'll go to questions.
Our first question is from Jim Province at the Toledo Blade. Jim, please ask your question.
Hello, Governor. Thanks again for doing this briefing. You specifically mentioned the Memorial Tournament in Columbus. Could you give us an idea of what's going to happen with the other golf tournaments, professional golf tournaments in Ohio, including like the Marathon Classic in Sylvania? What is it that the Memorial Tournament has done that they have not done?
Nothing necessarily. Look, we're going through a process. We're trying to get this information out as quick as we can review it. What they did is they submitted a full plan. John, I don't know if you have anything in addition to that, but
no, we're just. I mean, that's consistent. They're all working from the same template. We fully expect that, so long as they meet the same basic standards, that the other tournaments will be able to go forward.
No reason the other tournaments will not be able to do this. We just have not gone through their plan. But these plans, it's a lot less people there. It's the social distancing. It's all the things that they can do. And there's no reason any of them cannot do this. So I would be optimistic about them being able to do it. We just try to announce this when we get it, when we know that these can in fact take place.
Thank you.
Our next question is from Laura Hancock at cleveland.com. Put back to Laura. Our next question is from Marty Schladen at the Ohio Capitol Journal.
Good afternoon, Governor. How are you today?
Well, thank you.
Good. I'm glad to hear it. On Monday, President Trump ordered federal officers to fire tear gas and rubber bullets into a peaceful crowd that included members of the clergy so he could stage a photo op in front of St. John's Church. The move has been condemned by former senior military personnel and Episcopal and Catholic bishops of D.C. Do you approve or disapprove of Trump's actions, and do you worry about the Ohio guardsmen and women who have been sent to D.C. To be under his command?
Well, look, I don't know all the facts. I've seen what you've seen on TV, or at least something I've seen on TV. I'm not going to critique every single thing the President of the United States does. I'm not going to critique what my fellow governors do. I'm not going to critique what the mayors do. What I can tell you is that in the state of Ohio, we have tried to have the balance that is needed, that protects people who want to exercise their First Amendment rights, which we encourage them to exercise. We encourage them to exercise that. At the same time, protecting their rights and the rights of the rest of the public from a small minority of people who are gathering together, who are there to cause chaos, disruption, and some of whom are involved in looting. I can tell you that this is a difficult job. It's a difficult job for the police departments. It's a difficult job for the National Guard. Can mistakes be made in Ohio? Yes, mistakes can be made. Not everything is perfect. But we've worked very, very closely with our Ohio mayors, and they have had to try to figure that line out as their chiefs of police have. Not going over the line, but at the same time trying to protect the public and get that right balance. So I'm not going to critique what happened in Washington. I don't know all the facts of what happened in Washington. My focus is on Ohio, and our mayors have done a very good job. Our chiefs of police have done a good job. Have there been mistakes made? Sure, there are always mistakes made. But the men and women who are out there making these decisions, which are difficult decisions, let us not forget, and again, I'm talking about Ohio, but in every time you have situations like this, or it's not unusual, and this has been reported back to me by mayors, there is somebody out there who is trying to get a reaction from law enforcement, who is not interested in the protest side of it, but wants that reaction from law enforcement so they can do something. That's what the men and women who are out there have to deal with, and it's not easy, and it's tough.
Our next question is from Laura Hancock at cleveland.com. Laura, please ask your question.
Hi, my question is for each Dr. Acton and Governor DeWine. The Ohio Legislative Black Caucus and the cities of Cleveland and Columbus and the Franklin County Commission have sought to make racism an emergency. To this official, since there are efforts underway anyway.
Okay, I lost part of that, but let me try to answer it. Look, we understand that race and prejudice has historically and continues to have impact on people's health. That is borne out by the data. You cannot look at the data without understanding there's a lot of things that impact health, certainly poverty, and there are other reasons, lack of education, but that race is a factor, or the bias is a factor. And so what I'm focused on, and what Dr. Acton is focused on, and this DeWine Houston administration is focused on, is action. And we've outlined some things we want to do, both in the law enforcement area and in the area of having to do with health. And you're going to see those things, and they are unfolding. When General Harris talked about, we've talked about taking testing out. We are not only taking testing and focusing on testing in regard to our nursing homes, but you're going to see us have a significant focus on all underserved people in the state of Ohio, which certainly includes people who, African Americans, who in our cities and other areas are sometimes very underserved. And so action is what I think is needed. Action is what we will have.
Our next question is from Luis Gill at Ohio Latino Television.
Hello, Governor. Thank you very much for...
I can't see you now. We can't see anybody. Of course, our viewers never could see anybody, but so we just listen. Good.
Okay. Thank you, and thank you. You have been put to the test to this crisis, Governor. We're facing quite a bit of crisis in the city, state, and the only thing I can see that we're failing is that we don't have enough fingers to point out to officials that have failed the communities, the city, the state for more than 20 years. And we're seeing the consequences of all that. It has been 57 years since the last famous speech from Martin Luther King, I Have a Dream. And 7 years later, here we are, perhaps in square one. Nothing unites us. Skin color, different religion, political ideology, sexual orientation. We don't have anything to grab on. And the only thing I can think of is God, country, and the flag. We're tearing each other apart. Governor, we have to start somewhere to grab each other and protect each other, because perhaps we might not have a country in 100 years. As an official, Governor, what is a plan? Because what has happened before has been millions of dollars, many organizations, we're back, like I said, square one.
Well, I think that's an excellent question. That is a defining question for all of us. It's something anybody in public office, but every American, every Ohioan has to ask themselves. Our legacy is what some have referred to as the original sin of this country, which is slavery. And the aftermath of that, we are still living with that. I don't know that we're at square one. We can describe where we are. We've made progress, certainly, in some areas. In other areas, we've not made the progress that we want. The story of America, the story of Ohio, the story of all of us started with that original sin, great ideals, but imperfect. We're still imperfect, but what I think God asks of us and what we should ask of each other and our fellow human beings is to continue to try and not say we are where we need to be and not accept the status quo. And so I don't accept the status quo. There is more that we can do. We have great police officers, but sometimes we have police officers who somehow slip through and should be out of there. We have obligations to take care of that. And we have obligations if that police officer moves from one department to the other for that person's record to follow them. And there's things we can do, and there are things I intend to do. We have seen with the COVID-19 on taking the curtain back, if we needed to have it taken back, taking it back and exposing the fact that African Americans are suffering much more from this, and Latinos are, than some of their brothers and sisters. And that shouldn't surprise us because of the infant mortality rate that we see in this great state, which if you are a black baby, your odds are 3 times as much that you're not going to make it. So that should shock all of us. That should anger all of us. But what we should do is we can talk about it, and talking is important. Language is important, but we also have to roll up our sleeves and do the work. And so what I'm doing is I talk to the members of the General Assembly and talk to the people of the state of Ohio and say, let's do these things. Let's get some victories in the sense of doing things that matter, that move us down the road. We're not perfect. We're not going to be perfect, but we sure can be better, and we have great ideals. Thank you.
Thank you, Governor, and thank you to the First Lady for being there with you all the time.
Thank you very much, and I thank her. I thank her as well. In my inaugural address as governor, I talked about the lasting lessons I learned from both my grandfathers and my father, my family. They all planted trees into the last years of their lives. When they planted trees, I remember thinking they're not going to live to see those trees get big. Yet they planted them, knowing that future generations would someday enjoy those trees. In fact, as I think mentioned to some of you, our son John, my two grandfathers' great grandson, tapped some of those very maple trees each spring to produce maple syrup to sell and for our family to enjoy. And John actually had a banner year. He and Michelle had a banner year this year. My grandfathers and my father understood that sometimes we do things where the reward may not be immediate, but we do those things nonetheless because we have hope for the future. We plant seeds today in our hope for a brighter tomorrow. Like my grandfather and my grandfather and my father, I'm an optimist. Look, this has been a tough time. This has been a tough time for all Ohioans, some much tougher than others. But I truly believe that we will rise out of this virus and this great tragedy, and out of the disparities, the unconscionable disparities that we see in society today. Our great seal, which is on the podium right here, reminds us that the sun will rise on our beautiful Ohio again. There will be positive things that come out of our struggle with this virus. We're not really sure what all they will be, but they will be positive things. American ingenuity, innovation, creativity. We're seeing all of that as we battle back. Out of our struggle, we are going to learn things, and we are learning things. We will emerge stronger, better, more resilient, and we will do things that matter, things that will make a difference to help ensure that every Ohioan, whatever their color, wherever they live, will have the same opportunity to lead healthy, productive, and fulfilling lives. The tree that Fran and I and our grandchildren and our daughter planted today is a shagbark hickory, native to Ohio. We have one, to my knowledge, on our farm that I walk by when I'm out with our dog taking a walk. And Fran and I walk by it as well. It's a tree that I think is particularly beautiful. So we decided to plant that in what's called the Governor's Grove at the Ohio State Fairgrounds at the ODNR area. It's a tree that is a strong tree. These trees can live up to be 300 years old. It grows tall and sturdy. Its wood's hard, strong. It's tough, just like Ohioans. This tree represents all of us. It represents hope. It represents our faith in the future. It represents our resilience as Ohioans. The Bible tells us, and I quote, "Let us not grow weary of doing good, for in due season we will reap if we do not give up." Ohioans will never give up. We're strong. We're tough. We will not grow weary of doing good, and we will not grow weary of helping to protect each other. We are Buckeyes. We are strong. And I truly believe that the best yet is coming. So to all of you, we hope you have a great weekend. Thank you very much. We look forward to talking with you next week, I suspect on Tuesday at 2 o'clock. Thank you very much.
And there we are with Governor Mike DeWine ending his live press conference for today. And so Andy Chow, my colleague here, who's been covering these press conferences this whole time, as I understand it, the governor is going to continue to take questions from reporters afterwards, but wanted to conclude the press conference to conclude this hour of broadcast. So tell me the highlights here.
So what we learned is that, he recapped the different entertainment venues that are to reopen on June 10th. That's movie theaters and playgrounds and indoor play parks. And then he added for June 19th, casinos, racinos, amusement parks, and water parks. And like you said at the top of the program, that those were venues that were filing a lawsuit against the governor to start to reopen. So on June 19th, it looks like all is clear for amusement parks, water parks, racinos, and casinos to open up again.
And this comes at an interesting time because just yesterday when he made the announcement, not on a briefing, but in a press release, that for instance, zoos and aquariums and all these other venues could reopen, that amusement parks and water parks were specifically excluded from that. That resulted in a lawsuit filed by Kings Island, Kalahari Resort, and Cedar Point asking for the permission to open immediately. And so this doesn't necessarily negate that lawsuit, but it does seem to address some of the concern that they had about reopening along with everything else.
Yeah, and we've seen this in other venues as well. We saw it with gyms. There were a couple of gyms that filed a lawsuit wanting to reopen, even though...
Filed by the same group that's working with this lawsuit, as a matter of fact.
Yeah, and so even though gyms were already going to open in a few weeks anyway, they still went on with that lawsuit. It's possible we might see that again. And we heard really a long explanation from the governor today, really recapping what the process is behind his administration, looking into which sectors can open, how they try to get experts on board to create the specific guidelines and requirements, really defending the reason for why he thinks specific guidelines and requirements should be in place in the first place. And I think what we're also hearing the narrative from the governor today is really still pushing the message that COVID-19 is something to take seriously, that it's not something to let off the gas on. And I think that's something that's been interesting if you go from state to state. How serious are people still taking coronavirus? You know, if you compare the beginning of March, how serious people were taking it compared to now, the virus is still out there. We're learning more about the virus, but we're also seeing businesses reopen.
And we're also seeing big crowds of protesters, which the governor spent a fair amount of time talking about that. The Ohio National Guard had sent 100 troops to Washington, D.C. for security at certain monuments and that sort of thing. DeWine says one of those members has been recalled, removed from duty from Washington, D.C. after the FBI uncovered information that the member expressed white supremacist ideology before this assignment. So that's interesting. But he spent a fair amount of the press conference also talking about the concerns about the protests and the larger issue of racism as we're confronting that.
Yeah, and I think what we've heard, again, narratively from the governor and from what he's been talking about is that he wants to now take what he's calling tangible steps, tangible action to really try to address the issue head on. And he's identified racial disparities when it comes to minority health and when it comes to law enforcement. And he used the three words: accountability, oversight, and transparency. It seems like in the coming days, the administration is going to announce some work that he'd like to propose to the legislature to really move that issue forward. What we heard in the past is some sort of review process, maybe, where police have licenses and a licensure board that can review issues and maybe take that license away if the board thinks it's appropriate to do so.
All right, many things to be watching now into next week. The governor says we'll probably be back on Tuesday. Thank you, Andy Chow. I appreciate it. Let's go over some numbers here before we close. 2,135 confirmed deaths. That's 18 new deaths, down from 37 yesterday. 35,096 confirmed cases, 457 of them new, up from 431 yesterday. But the numbers of people who are currently hospitalized, currently in intensive care, and currently on ventilators have been going down. We had 43,533 tests, 8,925 of them new. So we're still struggling to get to that point. That concludes our live coverage of Governor Mike DeWine's daily update on coronavirus in Ohio. For more information, tune into Ohio's public radio stations and television stations, or our website, statenews.org. My thanks to my colleague Andy Chow. I'm Karen Kastler. Thanks for tuning in. Have a good weekend. See you on Tuesday.
Another person who works with shibori, this same Japanese technique, but shibori covers a lot of different ways of manipulating fabric. So how she